Hafade Guam, Adriana Cotero here, and I am joined with the Office of Civil Defense, sorry, my bad, but Administrator. We have Charles Esteves here. Hi, Charles.
Hey, Hafade.
Hi, so I wanted to ask you a few questions in regards to the federal medical stations that we received on Saturday through FEMA. I know this contains beds and supplies and medicine, so maybe you can go a little further in depth with what those supplies and what those different supplies are. And I know that they're in storage right now and that you guys are planning on creating alternate care sites and there's areas being designated. And, you know, I just spoke with the governor during the press conference, and she mentioned that some of these areas, you know, they include like the field house, but there's different restrictions that you guys have to follow. So maybe you can just go further in details on that.
Yeah, sure. So, there are a lot of considerations. So, for example, you know, the 50 FMS, the federal medical stations, there are square footage requirements. Has to be a climate control space. You know, some of the questions we asked ourselves is, do we have access to, for example, loading docks, ramps, you know, some material handling equipment? Is there sufficient existing communications and IT support? You know, do we have a generator at this site, right? Or do we have to get a generator? Also, you know, what are the availability of support services, right? Food and water, waste disposal, you know, medical oxygen, laundry, potentially mortuary services. Is there refrigeration, and, you know, what's the bathroom and shower capability? So, you know, the field house is one of the locations we looked at. We were looking at also our tier 1 and tier 2 shelters. So some of the gyms as well. Basically any sort of open space that can house these 50 federal medical stations, which we're also getting another 50, and we've requested for another 50 for a total of 150.
A total of 150. When will we be getting those, the additional 50 and then the others that you have requested for?
So the request, the second push for the 50 is it's on our way right now. I don't have the exact time, but the other 50 for the total 150 is currently being processed right now. So just to let you know how the process works for federal assistance. So we work in what's called the Unified Coordination Group. And so we have the Territorial Coordinating Officer, which is myself, which, you know, we coordinate all the activities within the government of Guam and within Guam itself. Then we have the Federal Coordinating Officer, which is Robert Fenton, who's also the FEMA Region 9 Administrator. So what they do is they process requests from us, from the different jurisdictions, and they mission assigned other federal entities. So for example, if we need equipment from med equipment from HHS, they'll mission assign HHS to provide that equipment. If we need DOD support, they'll mission assign DOD to either provide transportation or to provide, you know, medical personnel. And now we also have a Defense Coordinating Officer on island who oversees the coordination of all the different DOD assets on Guam as well. And so within the Unified Coordination Group, and I know we talked about the tactics meeting. So the tactics meeting is part of what we call the Incident Action Plan or Incident Action Planning. And so we have a tactics meeting, a strategies meeting, and a planning meeting. And in it, we set up priorities and objectives, and I can actually share those with you. The source document. And
who are all these people that you had previously mentioned? Are they all? Are they video conferenced in, or who's at the tactics meeting?
So we actually physically meet. So Robert Fenton is stationed at FEMA Region 9 headquarters. So he designated a division supervisor, which is Charles Chuckata, to basically lead what's known as the FEMA Incident Management Assistance Team. And during any emergency or event, they're the four, well, the kind of the advanced party to provide us immediate federal assistance. And the Defense Coordinating Officer, or the Deputy Defense Coordinating Officer, is also here. He's assigned to GRM, and so we do physically meet at our office, the three of us. And of course, there are other supporting elements such as HHS. And so we have the HHS liaison officers that attend this meeting as well. Local government of Guam partners, the state surgeon cell, and the cure action team, you know, public health. So we do our best to meet physically at the same time, you know, make sure we limit the number of people in our facility, as well as leverage other capabilities such as teleconferencing, video teleconferencing as well. So we can ensure that all the players are in the room.
And so you said, or you guys had just met yesterday, and you were designating the different areas, and you mentioned that the different requirements and criteria that they have to follow. But how big are these stations, essentially, like square footage?
Well, I mean, so they're regular beds, right? But the beds need to be so the bed is one component of it, right?
Mm-hmm.
Then you have the medical cache, you have the supplies as well. But they need to be spread out X number of feet. There's floor planning considerations. So a lot of these things are need to be accounted for, right? When designating the space. But the average recommended space is about 40,000 square feet. So it's a pretty sizable. So you're talking about like the field house, right? Or to football field size. And these federal medical stations are recommended for indoor use.
Mm-hmm. So you said 40,000. Would that be for the 50?
For
all
100.
150?
About for 100.
For 100. Okay. All right.
Well, a place like the field house can comfortably fit about 100.
Okay. So how soon can we actually see an area located, and you guys actually determining that this will be the site for these alternate care sites, and when they would be up and they would actually be coming together?
So it's not, so we work in operational periods. So the priorities set during this operational period, these are 1 week operational periods, is to expand our established alternate care sites to expand medical services capabilities and capacity. So I don't have the exact time of when or date when they're going to be set up. Just let this is not the only route we're going to establish alternate care sites. We're also contacting vendors in the States to set up portable, expeditious medical shelters, right? So, they're emergency medical shelters. They're basically tents. And in it has the full suite of medical capabilities. So this is separate than the FMS project.
Right. I believe I heard, the governor had mentioned that today during the press conference too. So between these two different relief efforts, what is the immediate response? Which one would be more of an immediate response?
Well, they're simultaneous projects that we're doing at the same time, right? Because the objective right now, at least in this operational period, this 1 week operational period, is to establish a minimum of 200 bed capacity, right? In anticipation for the surge. Thankfully, these numbers are adjusted every day, and the Dr. Cabrera and the Cure Action team, they're continually refining the numbers. Mm-hmm. And we we're definitely planning for worst case scenario. Mm-hmm. That's why if we were to just state our 6 priorities right now, the priority 1 is to promote containment. Mm-hmm. Okay, priority 2 is the expansion of public health operations. Priority 3 is the expansion of medical services capabilities and capacity. Our priority 4 is the sustainment of medical supplies on island. Priority 5 is to sustain non-congregate sheltering operations, which is the quarantine and isolation shelters. And then priority 6 is our public information and education. And so within it, we've established our different objectives. And I can tell you that the two objectives that we've emphasized during all our meetings and that we're putting all our resources to is the implementation of the enhanced mandatory social distancing protocols, and then the establishment of alternate care sites.
Hmm. Yeah, I mean, obviously this is our first time all going through this pandemic here, but I have worked with FEMA, done reports with FEMA after following Super Typhoon Mewtwo in the CNMI, and I mean, I don't need to tell you, but I think we all know that preparedness is key, especially in any sort of crisis. So that's why I really wanted to get some clarification and see if there were any set in stone dates on when these would be established or here. But yeah, so you mentioned,
Yeah, and I can tell you that, and the reason why it's really difficult sometimes to establish these dates, because there are additional resources that we have requested and also required to get this running. We've so you saw the request. I signed out one yesterday, the request for the strike team. So I signed that request for federal resources yesterday. It was sent to the region and approved. And so it is. So it's not a matter of you know, actually asking for the resources and getting approved for the resources, but you know, what's the timeline of when they're going to be able to deploy here? Because I think the issue was brought up is, yes, we can establish these alternate care sites, but you know, who's going to be manning them, right? Do we have the medical capacity on the island? Thankfully, we got approval for Title 32, 502F for the National Guard. And with that, you know, they do have medical personnel and capacity, right? Also, the folks supporting the Theodore Roosevelt, hopefully, you know, as the governor mentioned, we can leverage that capacity as well once they've completed their primary mission of protecting their force.
Yeah, I believe Admiral Manoni had said that they would be providing personnel, of course, after, I mean, with the outbreak of the USS Theodore Roosevelt, and I guess we don't know how soon that'll be, right? That they would come in.
Yeah, we don't, and so that's why, you know, we continue to update our incident objectives, refine them, our operational planning, you know, each week, right, and shorter if need be. Mm-hmm. But I can tell you that all the requests for federal resources that we don't have, that we don't have on island, you know, they have been submitted through the region, right, or through FEMA.
What about ordering more PPE?
So ordering more PPE, I want to say, you know, it's not that we've been lucky that we've, you know, been able to sustain our operations for the past month, given our current PPE supply on island. But it's definitely a national shortage, right? If not a worldwide shortage of PPE. But how we've been successful so far compared to other states and territories that have, you know, expressed that they are in dire need of PPE is the implementation of PPE conservation. So in the sustainment of medical supplies, what we've done is we've prioritized the distribution of medical supplies and equipment, and we have this distribution plan and prioritization for the next 180 days, or until we can establish a surplus. That medical health providers is number one, first responders is number two, and then all other personnel that may need, you know, basic surgical masks or gloves, you know, they're our third priority. We're also, like I said, we're promoting the enforcement of PPE conservation over the next 180 days. And then we've increased the number of government of Guam vendors in terms of medical equipment and medical supplies here on the island. Additionally, we've also requested for PPE through FEMA, through HHS. And so we've requested for you know, all the basic PPE, N95 masks, surgical masks, gowns, shoe covers, face shields, gloves. So FEMA, I mean, HHS has sent the strategic national stockpile, but it's a percentage of the total strategic national stockpile authorization for Guam. And the SNS supply is a, you know, break upon emergency. And so we're thankful that we haven't had to touch it yet. But if we get to that point, then, you know, we do have that backup cash if needed.
I was going to ask, is there any other further work that you guys are doing with FEMA?
Yeah, so well, I mean, not additional work, but after every single emergency, you know, we apply for, especially emergencies where we received a major disaster declaration, we normally apply for what's called public assistance. So under the public assistance program is where we would get reimbursed for emergency protective work. If this was, for example, a typhoon or other sort of natural disaster, then we would be requesting for reimbursement for physical damage. But right now, we're only approved for what's called Category B, which is emergency protective measures. So all the personnel costs, such as the overtime, the additional operational costs associated with responding and recovering from this event, those costs will be captured, and they'll be inputted into to the system with FEMA recovery, and they'll be assigned a project worksheet. And then we have basically over the next, you know, from the time the event ends, up to 5 years to capture or receive all those reimbursements. Right now, you know, we still have open disasters. We still have Halong, Dolphin, Mangkut, and Wuta. And those are open major disaster decks. So,
Oh,
you know, although we may return to a state of normalcy, recovery is a long and arduous process that can take potentially up to 5 years.
mm-hmm.
And so we are trying to actively manage recovery while we're in the middle of the response, and that's only because we don't want to have a backlog of people, you know, government agencies and eligible profit non-government nonprofit organizations and non-governmental organizations trying to seek reimbursement on the tail end.
Is there any work at all through the Office of Civil Defense with the Army Corps of Engineers?
Yes, so we submitted a request for technical assistance from the U.S. Army Corps of Engineers. That was approved. And so they mission assigned it to the U.S. Army Corps Honolulu Division, who then tasked and requested assistance of NAVFAC Kern Island. So we've actually been meeting with them and basically assessing different locations on island. And this is for what's called the hotel to healthcare or arena to healthcare model. And so basically what we do is we take a hotel or an arena or arena equivalent and we turn it into a healthcare facility. And so the purpose of the Army Corps of Engineer in that mission is to provide us with the, you know, basically the punch list of what needs to get done to make this happen.
Do you know what hotel would be used?
Oh, well, I don't know what hotel will be used, but you know, all hotels are being looked at.
Right.
Only because what we want to do is have the full list before we start discounting what hotels can't be used. Yeah, but hotels that are currently being used as a non-congregate shelter for quarantine isolation operations, more than likely we don't want to disrupt that operation. So those hotels will more likely be discounted off the bat.
Right. Yeah, that's where I was kind of going with that, just because I know that some are, you know, they are filled right now for quarantine efforts.
Yeah, and you know, it's we still continue to get people coming in to the island on a daily basis. So you know that quarantine, the mandatory quarantine operation, you know, it's enduring operation, right? Until, you know, either we curb the number of cases we get, or they stop the flights coming into Guam.
And I just wanted to go back. So you mentioned in addition to the tactics planning meeting, you guys also meet you also gather. Can you go over those different meetings that you have again real fast? Sure. And then tell us when you plan to meet again?
Yeah, sure. Not a problem. So what we have is we have a daily operations meeting with the governor, right? And from there, you know, we, you know, on the emergency management side of things, I try to capture her intent and the intent of, you know, the others in the room, the lieutenant governor, chief of staff, deputy chief of staff, and other leaders in the room. So what we do is we capture all of those, basically not do outs, but the guidance intent over the next several weeks, right? And what we do is we put that into an incident objective sheet, and we review that at our unified command objectives meeting. So we meet twice a week for our unified command meeting, or unified coordination meeting, unified coordination group meeting, and that's the people I mentioned. You know, it's myself, the division supervisor that reports to the federal coordinating officer, and the deputy defense coordinating officer, and other leaders. Then we also have our tactics meeting, right, which is weekly as needed. We have a planning meeting that's weekly as needed, and operations meeting that's weekly as needed. And so you know, there are different meetings, there are different people in these meetings. Sometimes there's a little bit of redundancy, but that's only because, you know, given the current event, things do change sometimes on a daily basis for how we're going to meet you know, meet a specific objective or end state. And that's only because, you know, we get new information every day, right? So let's say we found out that this capability is available tomorrow and it better meets our priorities, right? You know, we're going to go with that capability because it's, especially if it's an immediate need.
So you said you're meeting weekly, and there hasn't been a determined time frame on when these additional care facilities would be up and running. But is there a projected date at all? I mean, if you're meeting weekly, and then I mean, I don't know what the
Yeah.
conversations are like. Can we expect it within the next month? Can we expect it before, or, you know, is there anything projected at all?
Well, I mean, well, I'm confident that it'll be set up before the end of the month, and definitely within the next 1 or 2 operational periods. But you know, we established it. We've already tasked it out to, you know, who's going to execute it, right? So it's a combination of our federal partners, you know, our you know, Guam Memorial Hospital, the Cure Action team, also the Guam National Guard. So it's a number of people that we've, you know, a working group, right? That's actually going to execute and carry out the work.
Right.
So I mean, to answer your question, you know, that those tents aren't going to sit for too long.
Okay.
Because we need to make room for the next, you know, the next shipment of resources coming in.
Okay. So, and as of right now, the field house is that looking like the designated area for the most part?
Yeah. So I mean, it's definitely up there on the list. You know, once that's solidified, right? We'll definitely push it out that this will be the site. I just let you know, location as well, right? So the field house, you know, although it may be a good space because it's nice and open, they do have facilities, but it's also far from Guam Memorial Hospital, right? So those are other things that we need to take into account as well.
Is there a site that's closer to Guam Memorial Hospital that you're looking at then?
Well, I mean, so for example, with the medical shelters, the emergency medical shelters, you know, they're looking at the parking lot, you know, potentially the parking lot over at GMH, some spaces nearby GMH. So I can tell you that there's definitely a long list that is, well, that the group is looking at, and they've been doing assessments all week. They've been doing assessments last week. And so, you know, they're going to report out by the end of the week on this is where we want to have this.
By the end of this week?
Yes.
Okay. That's the time to have it. Okay. All right. Well, anything else you would like to add?
No, well, just that, you know, this emergency, especially since it's a national emergency, well, a global emergency, that really is going to take a whole of the government and whole community approach. That's
okay.
it. So.
All right. Well, thank you. I appreciate you taking the time to speak with me. And now that I have your number, I'll be in further contact just to follow for updates in regards to these different, you know, sites as well as the facilities and getting them up and running.
Yeah, thank you. And you know, if you wanted, you're welcome to sit in these meetings as well.
Oh yeah, we're allowed to join in.
Yeah, sure, why not?
Can I be teleconferenced in?
Yeah, if we can work it, we'll do it.
And what time are they?
Yeah, so you know, well, we'll send a meeting invite.
Okay. All right. I appreciate it. Thanks, Charles.
Thank you very much.
Thank you. And thank you all for tuning in. Again, that was the Office of Civil Defense Administrator, Charles Esteves, and he was going over the different plans that they're working on. There's not anything, a set time frame just yet, but they are looking at various locations for the federal medical stations, and we have about 50 here, an additional 50, and then they have made a request for another 50, so that makes grand total of 150. And as soon as they do determine a location, we'll be sure to follow on that and update you all. Thank you.